All right, still talking health. Zimbabwe has brought in a law that bans health workers such as nurses and doctors from prolonged strikes, imposing punishments of up to 6 months in jail for defiant workers or union leaders. The provision signed into law by President Emmerson Mnangagwa last week, but made public on Wednesday, stipulates that health workers can only strike for up to 3 days because they are considered as essential service.
Government spokesperson Nick Mnangagwa said health professionals should continue providing emergency services during a strike. Other countries, including neighboring South Africa and Zambia, limit strikes by health workers but impose less severe punishments, such as dismissals, work suspensions, or docking salaries. Joining us now to discuss this development is Peter Gift Mutasa. He's the chairperson of the Crisis in the Zimbabwe Coalition. Good morning, and thank you very much for joining us this morning to talk about this. Let's get into the conversation this morning to talk about this new development. Is it in any way justifiable to put a limit to how long health workers can strike?
Thank you, and good morning, and thank you for inviting me. The issue is the underlying cause. Why is the government taking all these measures? The government is taking all these measures because we are under a dictatorship. So the dictatorship is consolidating. The main aim is to make sure that they muzzle dissent, and they also block any social and economic forces from raising their grievances. So it should not be taken in isolation. It must be taken in its complete analysis that since the 2017 coup, the Zimbabwean regime has been consolidating its power. It wants to maintain an environment where citizens cannot raise their voices, whether it's workers, whether it's churches, whether it's student movement. There is a law that is stifling democracy, that is stifling freedom of expression, that is stifling freedom of association or freedom of assembly in all sectors. So that is the main underlying reason. But coming to the particular sector, the health services sector, we have a government that is failing to provide public services, a government that is losing legitimacy in terms of failing to provide public goods. And in one of the main areas that the government is failing is to manage the economy. And as a result, we have the highest inflation rate in the world, around 240, 44, 43, and that is quite conservative. We also have the highest interest rates in the world, 200% for borrowing to finance business or for personal borrowing at 100% interest. So the government is failing to pay sufficient salaries because salaries of health services workers are eroded by inflation and also exchange rate movements. So in order to silence doctors, nurses, radiographers, and everyone, the government is taking these draconian laws. It is a tool for consolidation of the dictatorship.
I want you to speak further on the health sector in Zimbabwe, and what are the things that health workers mostly strike over? Is it, poor pay, or are there other things that are, part of the conversation? What's the average pay? And I remember there's also stories of a brain drain in the health sector in Zimbabwe, with many nurses and doctors, leaving the country to work elsewhere. So can you shed any light on that?
So the main issues that our doctors have been complaining about is actually not even the salary, but it has been the frustration that they face working in hospitals that have no equipment, working in hospitals that do not have basic medicine. You cannot get a painkiller in our government hospitals. If you are supposed to go in theater, you need to bring your own stretcher, you need to bring almost all the equipment and all the drugs that are needed. So that is frustrating to health practitioners. who are now left to just watch as people die, who cannot even have any mitigation. And many of our people are unemployed. Many of the people are, even those who are working there, in poverty. So they cannot even go out and buy in private pharmacies or to provide those things. So doctors are frustrated seeing patients dying. People with disease that can be prevented, people with situations that can be prevented are dying in hospitals. The second aspect, the second issue is the salary, of course. Most of our health services sector employees cannot even afford to pay rentals. Nurses cannot pay rentals, doctors cannot even pay rentals, they cannot send their kids to school, they cannot provide, they cannot fund their own transport to come to work daily. So those are the main issues that the health services workers have been complaining about. And as a result, many of them who are finding that despite raising the grievances, the government is coming tough on them, arresting their leaders, victimizing them, abducting and torturing their leaders. So they are now voting with their passports. They are now crossing the borders, working elsewhere where their services are respected. As of November 2022, the ministry had reported that almost 4,000 health personnel had left the country since 2021. And we are a country that does not have many doctors, a country that is already facing challenges in terms of all staffing all the different sections in hospitals and the health service sectors. So 4,000 is a big, big number. But unless the government addresses the genuine concerns of the health services workers, why not just the nurses or doctors, everyone in that sector, including the nurse aide, who now have to wear plastics because there are no gloves when they are cleaning hospitals and they are cleaning floors with blood. They do not even have personal protective equipment, which is the third aspect that they've been complaining about. So we are going to see many health services workers going out in droves, and that is going to exacerbate the situation under an environment where the government is not even able to train more.
Well, we only can hope for the best. It's not looking good. About 4,000 doctors and nurses have left since 2021. And according to reports, nurses in Zimbabwe earn as low as less than $100 a month, and that's not looking good. We certainly hope that, we hope for better days, really, because there's no other way to look at this.
Yeah, but I just want to, is there, as quickly as possible, are there labor unions that can maybe fight on behalf of the health workers?
Yes, there are unions that are there and they've been defending workers and nurses, but the military regime is coming hard on them. A number of the nurses leaders have been arrested before, some have even escaped the country. A number of doctors leaders have been abducted, tortured, and arrested. Some have escaped the country. So it is a difficult environment for unions to operate in. And this law is going to make sure that trade union leaders are not going to call for strikes because you face 6 months in prison, and at times you face much more months in pre-trial detention, as we have been witnessing. But just one thing to correct, nurses are no longer earning under $100. That could be something that they were earning before. The government has tried to increase it a bit, but still below the poverty line. And much of it is not on the salary. It's what they call COVID allowance. So you can't plan with it. They give $200 as COVID allowance. You can't plan with it. It can be taken away anytime. So nurses want and doctors want a stable salary that they can use to borrow, that they can use to make decisions about sending their kids to school, and that is not coming from the government.
All right, thank you very much for clarifying that. I mean, of course, the report is a report by Reuters, and it's maybe very exciting or heartwarming to see that they might be earning more than that. But we look forward to some form of balance in that region. Thank you for joining us this morning.
Thank you, but it's still not sufficient. It's below the poverty line.